The information discussed by the host and guests on this talk show is meant to be informational only. Listening or calling in to ask questions for our guests does not create a patient-doctor relationship. Rely on your own doctor or healthcare provider's medical advice to treat or diagnose any conditions you may have. Nothing discussed on this talk show is meant to replace your doctor's medical advice. You should never stop your current medical treatments or delay getting medical treatment because of anything presented in this program. If you want more information about a medical condition or treatment discussed on this program, talk to your doctor.
It's time for Health Check with Heidi Godman, a daily dose of health and wellness information. Call or text Heidi your questions at 373-1220. That's 373-1220. And now here's Heidi Godman.
Hi, everybody. Welcome to Health Check. I'm Heidi Godman. Hope you're doing well on this great day. We have a very interesting program lined up for you today. In a little bit, it'll be time for our weekly brain boost, and we'll speak with Dr. Dean Sutherland, who's a neurologist here on the Sun Coast, and we'll talk to him about a new study that suggests schizophrenia patients can be calmed by a video game. Schizophrenia patients can be calmed by a video game. Wouldn't that be an interesting concept? So we're going to talk to Dean about that, see what he thinks. And of course, so many people in this world and here on the Sun Coast are coping with mental illness. And we talk to the folks from NAMI all the time, the National Alliance for Mental Illness. So this will be interesting. I'm curious to find out what it is. I'm also curious to find out what our first guest has to say. Dr. Manjula Jegasothy is a Harvard and Yale-trained aesthetic dermatologist, and we've talked to her, just lots and lots of times about all kinds of topics. Today, we're going to be speaking with her about a new filler for acne scars. That's later in the program. Also, how to choose a legitimate or a credible cosmetic doctor, because sometimes there are some people out there who say they can do procedures, and maybe it turns out they really shouldn't be doing them. How do you know who will really take care of you? Who would you trust your beautiful face or body with? You want to make sure that you know how to do that and scope somebody out. So Manjula is going to give us some advice about that. But we are going to start by talking about mascara. So is it good for your eyelashes? Do you wear mascara and find that maybe your eyelashes are starting to fall out? Have you ever heard about that? She's going to tell us about that. Welcome to the program, Manjula. How are you?
I'm great, Heidi. Thank you so much for having me back.
I'm excited to talk to you because I know a lot of women struggle with thin or breaking or eyelashes that fall out. And I think it's a very interesting topic. So tell us a little bit about mascara, and just generally speaking, is it okay to wear it on your eyelashes?
Sure. I think one thing we are starting to realize more in recent years is that thinning and falling out of the eyelashes is actually a normal function of aging. Just as a lot of women experience thinning and falling out of scalp hair, the same thing happens with the eyelashes. And so focus has become more on, treating your eyelashes or, taking better care of them or using growth supplements and such as an anti-aging measure. Now, mascara obviously is popular with women of all ages. And, the main thing is that most modern formulations are very safe. Unless you're actually allergic to any component of a given mascara formulation, mascara itself is not dangerous to the eyelashes or the skin of the eyelids.
But you see some mascaras that say, oh, we can plump up your lashes, or some mascaras come and they're clear, and then some are colored. Do these different mascaras have different impacts on eyelashes?
Okay, so the clear ones really are just kind of a protein coating that will perhaps make your lash a little bit shinier, the hair of the lash. And then the ones that are volumizing simply have a thicker protein matrix that sort of, plumps up each individual hair. And then they talk about all the different brushes, making a big difference. And there haven't been actual clinical studies to determine the different brushes and what's optimal. That kind of study would be ongoing and forever because there's a new formulation in the drugstore shelves every week. But in terms of colored mascara, I think there we could get into some issues with some of those pigments causing allergies. And so I would definitely, before starting, going all out on a big night out with a colored mascara, I would probably patch test it on the inside of your arm or something like that, much like we recommend patch testing for Nair or other depilatory hair removers, because all of those have sort of, they can have allergy-inducing ingredients or allergens. So it's a good idea to test them beforehand. But if you have no allergies, all of them are fine, and really they're just, kind of you suit them to your individual preference and where you're going and what the purpose of the application, the mascara application, is for.
Now, what about waterproof mascara? Because I would imagine if you're worried about your eyelashes falling out, it's harder to scrub off that waterproof mascara. Is that a good idea if you have eyelashes that are thinning or falling out?
Right. So that's a great question, because in my opinion, it's not, if you're not allergic to any component of mascara, it's the actual act of taking it off that indeed, makes most people's lashes either break, thin, or fall out. So being too rough with your eyelids and your eyelashes is probably the predominant reason that people who wear mascara all the time find that their lashes are thinning or shorter. If you're going to use a waterproof mascara, which, there are good formulations out there now, I just recommend that you use a really good oil-based emulsifier to remove them. A lot of common makeup wipes don't really have a lot of oil in them. I know we've discussed before, Heidi, micellar water cleansers, which are basically oil suspended in a water micelle. And Garnier makes them. There's a lot of different drugstore brands that make them. And that's a really wonderful way to take off waterproof mascara. You put some of that on a cotton ball and just let it soak into your eyelashes. And then it comes off in one easy swipe without any pulling or tugging.
Okay. All right. And then does mascara change the color of your eyelashes? If you have very light eyelashes, does wearing mascara turn them darker or anything like that?
Not permanently. One would wish, there's a big industry around dyeing people's eyelashes in different salons and stuff all over Miami. I don't know if you guys have that in Sarasota. Not the eyelash extension salons, but the ones that'll curl and tint your lashes. Do you have those?
I think that we do, yeah.
Yeah, so no, it has not been found that any mascaras significantly tint your lashes to any degree. That would be great.
All right. And then what about for people who do have the lashes that are falling out or thinning? I know that there are just different medicines that you can brush on to make them longer, thicker. How effective are they?
So there are a lot of over-the-counter products. I know Rodan and Fields has one that people swear by. There's another one that's available online called MD Lash. And there's a third one online called Revitalash. And I personally, anecdotally, have seen many of my patients use all three of those and have had extremely good results. The clinical things that have been proven in studies are having adequate protein intake, making sure you're not having thyroid issues, and then, taking biotin supplements and not perhaps niacin supplements also. The B12 complex vitamins are great for hair and nail growth.
Wasn't there a thing, though, that with these medical sorts of eyelash growers that it would turn the iris in your eye a darker color or something like that?
Yes. So then we come to the sort of the standalone category of prescription topical medication to grow the eyelashes. That product is called Latisse, and it's made by Allergan, which is the company that manufactures Botox. That product was actually, it's an eye drop solution, and it was originally invented to treat glaucoma. And then these patients who were using it for glaucoma, it wasn't a tremendously effective drug for glaucoma, but they noticed that their eyelashes were growing. And so then Allergan did studies on eyelash growth, and they found that, it indeed grows the eyelashes. In the patients that were putting it directly into their eyes for glaucoma, Occasionally, I think the incidence was like maybe 20 to 30% of blue iris people, so blue-eyed people, it would turn their iris into a hazel or light brown. But that was when you put the eye drops directly into your eyes. They have to preserve that warning on the labeling because it still is the same medication, just repackaged. But for eyelash growth, we use it very differently. We don't put any solution into the eye. We literally dot it along the lash line and then don't let it get into the eyes. And so there have been no reports of it changing eye color in that situation.
All right. Very interesting. And so otherwise it's safe and anyone is a candidate for it or not?
It is safe. Anyone is a candidate for it. I'll tell you, my one experience with it is that in darker-skinned individuals, like as myself, if you do spill a little bit onto your skin in the area around it, like the eyelids, it can turn the eyelids a little bit darker, which is kind of a not so attractive thing. It used to give me under eye circles a little bit. So you have to be really careful in applying it to a very small area there where the lash grows out of the eyelid.
But if you stop using it, then the color goes away, and also I would imagine the lashes stop growing as much.
Yes. And actually, I find that, an optimal dosing strategy is that you don't have to use as much as they say to use in the package insert because obviously they want to sell more product. I found that if you use the product, you apply it with your fingertip rather than the brush that they supply. The brush also wastes a lot of product. So so that way you use it sparingly with the fingertip, 2 to 3 times a week for 8 weeks, and you'll see a noticeable improvement in your lash width and length. And then after that, after about 8 weeks, you can go down to using it twice a week or even once a week, and then you won't have this issue with the pigmentation of your skin, but you'll still have the results of the eyelashes.
And so which one works better, the MD lash or Revitalash or Latisse, or is it about the same?
We have no head-to-head studies on this topic, but I would say for each person it's different. I know lots of my friends have tried all of them, and one person swears by this product, one person swears by another, and so I don't think it's clear that there's a clear-cut winner yet.
Okay. All right. Very interesting. We want to continue speaking with Dr. Manjula Jegasothy from the Miami Skin Institute. We need to take a quick break, though. When we come back, we are going to talk about what you need to do to find a qualified, credible cosmetic doctor. This is Health Check with Heidi Godman on WSRQ. We'll be right back after this.
The moment I wake up, before I put on my makeup, I say a little prayer for you. Oh, I'll comb in my hair now.
Welcome back to Health Check. I'm Heidi Godman. If you're just joining us, we are speaking today with Dr. Manjula Jegasothy. She's a Harvard and Yale trained aesthetic dermatologist, and she's the founder and owner of the Miami Skin Institute in beautiful Miami. We've been talking about different subjects today. We want to turn our attention now to finding a cosmetic doctor, because you see all kinds of doctors advertising that they can make you look better. But should you really believe them? Should you trust your appearance to just any doctor? We're going to find out. And Manjula, this is probably a pretty sore subject for MDs out there.
Yes. It's funny. We do all of this postgraduate training after medical school, and then we take very rigorous board examinations to be board certified in our specialties. And then we have to continue taking those examinations to retain our board certification for our entire careers. I mean, it's a large part of our free time is spent keeping up our credentials. And especially in the cosmetic industry, there are so many other people, other non-physicians and then non-board certified physicians who are doing these procedures. And the public doesn't really realize that they're any different from those of us who are considered experts.
Yeah. So what are the different doctors to stay away from? I'll bet you've heard of some really crazy situations I mean, here on the Sun Coast, many years ago, there was a physician arrested for performing cosmetic surgery. It was a breast augmentation, and he was a dentist. I don't even
Yes.
understand how that happened, but that was one situation. What about for facial cosmetic situations? What are the types of doctors that are qualified to do that?
So essentially, there are four specialties who are considered, amongst physicians to be what we call core, CORE, core providers of aesthetic procedures. These are the four specialties that generally pioneered most of these procedures. They were first to do them, and these physicians we feel who did these residencies are the most equipped to not only perform the procedure, but then to handle any possible complications or issues related to the procedure. My main message to the public is that, so lots of different providers, not even physicians, nurses, nurse practitioners, et cetera, can take a weekend course in Botox injections or filler injections or even laser and then be performing the procedure to a moderate degree. But then if something happens, they have no idea how to manage the complication. So my message to the public is really, you want to be seeing someone who has enough knowledge of the skin and underlying tissue that they can manage your complications should something go wrong, or, they're equipped to take care of it with, you're having no cosmetic disfigurement afterward. I mean, in my opinion, the standard for aesthetic procedures is much higher than the standard for treating sick people. Because, if you have a cancer, if you have an illness, and you end up with a scar after a surgery or something like that, that's legitimate. You had a problem and it needed to be fixed. But if you were fine and you're going for a procedure to make you look better and you end up looking worse, that's just completely unacceptable,
Well, and I want to point out, too, that not just any medical student can become, number one, a dermatologist, or number two, a surgeon. I mean, you have to be,
Yes.
there are a lot of hoops you have to jump through. You have to be in the upper tier of your class. You have to have certain tests that you pass. I mean, it's much harder to become a cosmetic surgeon than it is, for example, a primary care physician. Not that we don't desperately need primary care physicians, because we do, and there are so many really great ones out there. But I think that it's important to point out that cosmetic surgeons really have gone through a lot. I have a friend who had training in ophthalmology, and then he had a residency in cosmetic surgery. I mean, and so he focuses on the face. You are a dermatologist, and then well, tell us a little bit about your training.
Sure. So the four core specialties are ophthalmology, as you mentioned, your friend, dermatology, me, ear, nose, and throat, ENT, and then people who are general plastic surgeons. So for all of these people, we first have to do a year of either internal medicine or surgical internship. And then for dermatology, which is still the hardest residency to get into, we have 3 more years of dermatology residency. And when I was graduating, we didn't have this, but nowadays most dermatologists who specialize in cosmetic or aesthetic dermatology go on to take a 2-year additional fellowship in that field as well. So for the ENTs who become facial plastic surgeons, they do 1 year surgery internship. They do 3 years of ear, nose, and throat, medical ear, nose, and throat residency. And then they do 2 or 3 years more of facial plastic surgery. And that's when they're accredited. Then oculoplastic surgeons, they do 1 year of internal medicine, and then they do 3 years of ophthalmology, and then they do 2 or 3 years more of oculoplastic surgery, and that's your friend who's an oculoplastic surgeon. And then plastic surgeons do 5 years of general surgery residency, and then 2 or 3 more years on top of that of plastic surgery fellowship.
Yeah,
it's a lot.
It is a lot. I think the only ones that do more than surgeons are neurosurgeons, and what is that, 8 or 9 years? Some
and heart surgeons.
And heart surgeons. Yeah, just incredibly, incredibly difficult, rigorous training. That should just underscore everybody listening the point of why you want to go to a specialist because they do have the training. So, Manjula, how would we find someone who's going to be a great cosmetic doctor to see? Because maybe you don't have to have surgery. Maybe you do just need a sort of small procedure.
Well, nowadays I think most of the surgeons who do, the oculoplastic surgeons, the facial plastic surgeons, and the plastic surgeons do a lot of these minimally invasive procedures that I do. But it's not the same vice versa. Not all dermatologists do these surgeries. In my opinion, if you're looking at someone online or you've heard from a friend, you investigate, you look at their before and afters, make sure that they have a lot of them, and then you need to look that they're board certified, not just board certified, but board certified in one of those 4 specialties: ophthalmology, dermatology, ENT, or plastic surgery. So, a lot of people who are dentists or who are family practitioners or internal medicine or anesthesiologists, they're board certified in anesthesiology or in internal medicine or in dentistry, but they're not board certified in the right field for cosmetic surgery.
Yeah, and you just shouldn't take a chance. Also, a good idea to just ask the doctor, how many of these procedures do you do a week or per day? And it should be a lot, right?
Yes, I think all these procedures, I tell my patients, it's like practicing the piano. As it has to do with motor coordination and your hands and your eyes. And the more you do it, the better you are at it. That's all there is to it.
So much to know about it, and I'm so glad that you're here to give us this insider info. We're going to take a quick break, but in the meantime, Manjula, if someone wants to check out your website, can you tell us real quick what it is?
Sure. You can check it out at miamiskininstitute.com. It's all one word. I'm very active in blogging. I have 2 Google Plus sites, Miami Skin Institute, as well as a WordPress site, LinkedIn, Show Me Local. So, and then we have these podcasts under iTunes for Miami Skin Institute, as well as Health Check with Heidi Godman.
Fantastic. All right, we are going to take a quick break. When we come back, more with Dr. Manjula Jegasothy. This is Health Check with Heidi Godman on WSRQ. We'll be right back. Welcome back to Health Check. I'm Heidi Godman. We are speaking today with Dr. Manjula Jegasothy. She is a Harvard and Yale trained aesthetic dermatologist and the founder of the Miami Skin Institute. We've been talking about some very interesting things today. Does mascara damage your eyelashes? And also how to find a good cosmetic physician. So you've got to look for someone who is an ophthalmologist or a dermatologist or an ENT or a plastic surgeon. A lot of very important things to keep in mind when you're looking for someone who's going to take care of you. And we want to change the subject now, and we want to talk about something that sounds pretty different. It's a new filler for acne scars. And Manjula, acne scars really affect a lot of people in this world.
Yes, and unfortunately, you may have had acne just for a year or 2 in your adolescence or early adulthood, but then it's lifty with these pitted acne scars that seem to improve a little bit with time, but then as you actually get older into your late 40s and 50s, they start sagging worse than your normal skin, and so they become very noticeable again. There's sort of 2 peaks to the suffering associated with acne scars.
So what's typically the way that you treat that? Is it laser surgery?
Yes. So for the sagging acne scars, we're getting very good results with radiofrequency laser treatments. And they're simple, they have no downtime, and they're not painful, and they do very well. Prior to 5 years ago, we had no treatment for this. But for very deep acne scars that are either bound down, we call them ice pick acne scars, or if they're actually like almost rectangular, we call those boxcar acne scars. Those need to be actually freed, meaning the fibrotic band that holds the skin down needs to be cut. And then generally we put filler into that area to lift the indented skin. So essentially, Bellafill, which is a new product that is being marketed for acne scars to be treated in this way, is actually a reformulation of a fairly popular older European filler called Artefill and then Articol. And so, it's had several lives of its own. Several companies have bought and sold the product, and it's a good product for acne scars. It has a semi-permanent result in the sense that in clinical studies and for their FDA approval, patients had up to a 5-year longevity with it, which can be very nice. There are a couple of problems associated with it. The collagen that is basically the filler is formulated with these plastic almost type spheres, which contain collagen inside them. Now, in Europe, those plastic spheres sometimes cause people a lot of allergies. We're not seeing that so much the case, but the issue is with something that lasts 5 years or even longer, your face can change a lot. You can lose weight, you can gain weight, your face can change in the way it's draped over over the bony structures underneath. And so a lot of people don't think that a very long-term filler is a good idea because it doesn't change with your normal tissue. So that's one problem. And then the second issue is that the collagen, which is inside these spheres for Bellafill, is actually a bovine collagen. It's sourced from cow sources. And so this can be a problem for people who practice vegetarian diets or vegan ways of life, or even people who are perhaps Hindu and, don't consume any beef. So I always tell people, to make sure to discuss all your options and what the ingredients are in every filler before you get it in your face.
Sure. So what about this new one? I mean, how does it compare to other fillers out there for other parts of the face, so such as Juvederm or something like that?
I personally think the main advantage, as I said, is that it lasts about 5 times as long as any other filler. And so people who are perhaps limited in their resources and have no issues with, a bovine sourcing or something like that, this might be the ideal thing for them. I prefer a synthetic filler because then there are no issues with, animal sourcing or anything like that. So I prefer the hyaluronic acid fillers currently.
Do you think that eventually they'll start using these longer lasting types of fillers for other parts of the face and not just acne scars?
Yes, I definitely think so. In fact, both Juvederm and the Restylane lines of hyaluronic acid fillers launched, in the last three years or so, thicker, high viscosity fillers such as Voluma, and then Restylane has a new one called Define, which is really mostly geared for filling in the temples or the cheeks. And that has up to a 2 to 2.5 year longevity. Again, anything longer than that, I would be a little worried because everybody's face does change over the course of time, and the filler doesn't. So if it's going to be a long time, I don't really recommend it. I say 2.5 years is the most you need.
Sure. So how long before we get a type of a Botox that can last longer?
Sooner than you think. I think that might be our next topic. There's a company called Revance that looks like their initial studies, they have a botulinum toxin, which is lasting twice as long as Botox.
I think that's great. I used to get Botox when I was on television, and now before I was getting it like twice a year. Now I get it maybe once a year. I do it for myself. I like the way I feel better. I get these deep lines in my forehead, and I haven't gotten it in a long time, so I'll be probably visiting my doctor soon to get that. But it doesn't last that long. It's like 6 to 9 months, and then you're back to those brow furrows of the 11s between your eyebrows.
Yes.
And I don't like that.
Yeah, I think people are really going to like this new botulinum toxin. It's probably going to be out. It's going to be, I still say, 2 or 3 years away.
Okay. All right, well, I can wait. I'll only have more wrinkles by then, so I can definitely wait. Okay. All right. So that's it sounds like it's encouraging news for people who have acne scars, that whether you're trying this new type of acne filler or whether you're getting a surgical procedure, that there are solutions out there for you.
Yes, there's lots of solutions. and a lot of newer non-invasive ways to treat them that didn't exist before.
All right. Well, very encouraging, and as always, great to talk to you, and I sure appreciate your time. Tell us all the ways we can find out about what you're doing.
Sure. I would love it if you would visit me and give me good reviews on my Facebook page, Miami Skin Institute. I'm also very active on Instagram. My handle is at Miami Skin Institute, as well as on Twitter, which is at Miami Skin Ins. And then all the blog sites, Google+, LinkedIn, Show Me Local, as Miami Skin Institute, and of course our website, miamiskininstitute.com.
Okay, Dr. Manjula Jegasothy, thank you so much for being on the program.
Thank you so much for having me, Heidi.
Okay, take care. All right, everybody, again, if you're interested in finding out more about Dr. Jegasothy, just go to miamiskininstitute.com. We are going to take a quick break. When we come back, it'll be time for our weekly brain boost with Dr. Dean Sutherland. This is Health Check with Heidi Godman on WSRQ. Stay with us. Welcome back to Health Check. I'm Heidi Godman. It's time now for our weekly brain boost, and for that, we turn to our great friend, Dr. Dean Sutherland, who is a prominent neurologist here on the Sun Coast. And today we are talking about a type of mental illness known as schizophrenia and an interesting new development in research. Hi, Dean.
Good afternoon, Heidi.
Hi. So schizophrenia, this is a terrible condition for so many people. It can be debilitating in a lot of different ways. Tell us about it.
So as you said, it's scary and debilitating for most people that have it. Some people can do quite well with it, but it's a brain disorder that we think is probably for the most part genetic, although there are some people that certainly have it without a family history of such. And what it does is it causes people to have, around the time they're 18 to 25 years old, they start to develop problems with their thinking. They can have usually hallucinations, which is hearing voices, which we'll talk about a little bit later today. They can have disorganized thinking, which is where they don't make sense when they're trying to explain something or to go through a process. They become socially withdrawn. They often don't take care of themselves from a hygiene perspective, and so it's a social problem essentially, because you wind up with somebody who's normally functioning up until the time they're a late teenager, and eventually become non-functioning, and they at that point they can't really hold down a job or hold down relationships. Now that's again not true for everybody with schizophrenia. There's a spectrum there, so that some people are high functioning and do very well and have fairly normal lives, whereas other people are very debilitated with it, and some of those people become institutionalized in hospitals or mental institutions.
Yeah, and it can be really quite a sad thing to watch. Before we went on the air today, I was telling my producer, Luke, my cousin had schizophrenia. He passed away a few years ago, but it was right around the time when he was about 18, 19, 20 when this developed, and he had a very difficult life. Luke was telling me he knew someone with schizophrenia, and he watched a similar decline, very difficult. So now along comes a study that seems kind of promising. Tell us about it.
Well, this is really interesting. So this is really sciencey, nerdy kind of stuff. But at King's College in England, these researchers are using something called a functional MRI study. So functional MRI is when you have an MRI of your brain and it's live. They can actually see what's going on in the brain at the time that they're doing the MRI. So parts of the brain that are active can light up, and they become certain colors on the screen, and you can see what parts of the brain are the most active. So what these researchers did is they took several people with, I think 12 people with schizophrenia who were hearing voices. And the voices that they were hearing were not, fun kind of, hearing a song or having someone singing. These are people who have what we call intrusive voices, which are usually saying bad things about them, very negative things that make them feel like they're being picked on all the time. And so if you can imagine that being generated from within your own head all the time, it's very disconcerting and debilitating. And so they took these 12 people and they taught them to play this video game. But what the criteria for playing the video game, which was landing a rocket ship on a video screen, was that they had to light up the part of their brain that has to do with language and hearing and voices. So they were actually, this is the wild part, they were looking at their own brain on live on a monitor while the MRI was going, and they were playing the game. So in order to land this rocket ship properly, they had to light up the part of the brain that has to do with language. And what they were able to find is that they could get the people to learn how to play the game properly, and they did learn pretty quickly. They were able to suppress these bad voices, which were then no longer projecting these bad thoughts into their daily lives or daily routine. So they could suppress them enough to where they were either gone or significantly reduced. And then after 4 sessions, it looked like they were still able to go back to that sort of mental behavior later on without using the functional MRI machine, and to use that mental behavior to decrease the voices. So it's almost like a biofeedback sort of a loop, but very, very high tech. I think it's
exciting, encouraging. Oh my gosh! And I'm thinking now of other mental health conditions where there are unwanted thoughts. OCD has unwanted thoughts, and the applications really could be life-changing for so many people who have these thoughts. They don't want the thoughts, and then they just sort of occur. Do you see maybe this being applied in other ways to other conditions?
I think just about any condition that you can show that there's a brain region involved in this, I think it could apply there. As you mentioned, anxiety, which a lot of people have a little bit of anxiety. Some people have terrible anxiety to where they can't even function very well. And we do know that there are parts of the brain that light up when you're anxious and you have anxiety attacks. And so that would be a really great way to maybe to do that as well, so that people could go out and function in the community and not feel like they're trapped. A lot of people just won't get involved in things because anything that they do makes them very anxious.
I don't quite understand how landing the rocket ship on the particular place in the video game is teaching the brain to suppress thoughts. How does that work? Do they know?
They didn't put in their article what the proposed mechanism for this is, other than you're kind of distracting from that area. You're taking that area that normally would be generating bad language and thoughts and projecting it into your thought processes, and you're trying to distract it and use it for something else, which is to concentrate on landing this rocket ship. So it doesn't have the ability to produce the voices anymore.
All right. And of course, that's just a small study, and it would take a larger study, but I understand that they're planning to do a really large randomized controlled trial now.
Yeah, boy, what a game changer for schizophrenia this would be.
That would be. But meantime, we don't have that game changer yet. So tell us about the typical treatment that's involved.
So most people who have schizophrenia wind up getting treated by a psychologist and or a psychiatrist. And along the way, they'll probably want to be put on these drugs that we call antipsychotic drugs. So antipsychotic drugs have actually been around for 50 or 60 years or so. Probably people in our generation remember One Flew Over the Cuckoo's Nest, that movie, where people were given little yellow pills at their mental institution. That's kind of the way people still think of schizophrenia and treatments. What we know now is that there are different classes of these drugs, and some of them have more side effects than others. So the ones we call typical antipsychotic drugs are the ones that have been out there for 50 years, like Thorazine and things like that. And those tend to have more side effects for people. And they make you look like you have Parkinson's disease, basically. They make people kind of slow-moving, sluggish. They can gain weight. They have decreased facial expression. They may even have a tremor. A few years ago, we came up with another class of drugs, which is now called atypical antipsychotics, which have a lot fewer of those side effects. If you look at the numbers, it's not drastically fewer side effects, but it is significant. So I think something like 30% of people on the typical or older antipsychotics will have those side effects, whereas about 20% of people on the newer ones will. So the newer drugs are things like Abilify, Zyprexa, and some of the other drugs. And so those drugs are probably preferred now because they have less other side effects too. There's one called tardive dyskinesia. Have you heard of that one?
No.
So tardive dyskinesia is when you're taking a typical antipsychotic for many years, people get movements often in the mouth or the tongue or the face that are kind of repetitive, and they can't really stop it. It's almost like having a tic, but it's a very powerful tic. And that could be socially kind of, disconcerting for other people who don't realize what's going on. You just see someone in a restaurant, making mouth and face movements because they've been on these drugs for so long.
Mm. Oh, yeah, that sounds very frustrating. And there are a lot of different medications. So maybe is it a situation where you have to just try different medications to see what is the best fit?
That's usually true. That is true. And sometimes they kind of become ineffective. And one of the things that we know about a fair number of people with schizophrenia is that if you treat them with antipsychotics and they get better and they start functioning, a fair number of them will talk themselves out of taking the medication because then they feel like they're normal again and they don't need the medicine. It becomes this kind of recurrent loop where people go off their medications, they become psychotic again, and they have to go back on. And that also can cause problems going on and off those drugs frequently.
And
or the drugs, wind up getting switched to a new drug. Along the way, there's other drugs that are used because a lot of people that have anxiety and depression. So a lot of the typical drugs that you and I always talk about, Prozac and Zoloft and other things, Celexa, those things are also used in conjunction with some of these antipsychotics to try to treat people for their other side effects of the schizophrenia.
So then what about some of the pill-free treatments that are used to treat some types of mental illness, such as vigorous exercise? Can that help to improve treatment in schizophrenia?
I don't know that, Heidi. That'd be really interesting to look and see if I bet there's been studies that have been done on that. I wouldn't be surprised if it ameliorates at least some of the symptoms.
It does seem to help everything, exercising.
That's right. As we said before, we have yet to find a disease that exercise doesn't help.
It's true. It's true. Well, tell us some of the symptoms of schizophrenia in case anyone out there is wondering.
Okay, so it's usually, again, in younger people, they can hear voices, which are called hallucinations. Visual hallucinations are not as common in this disease as they are in some other problems. So hearing voices, and it's usually voices that are telling you, bad things. So it's usually people who are late teens, early 20s, men more than women, and they start to have a personality change and become disorganized with their thoughts and speech. They kind of become withdrawn, whereas they might have been normal socially prior to that. They become, kind of withdrawn and don't want to interact with friends, and they might kind of be shut-ins and stay in their room. The typical place that we see this is when people go off to college. Kids go off to college and they become they get thrown into a new situation, becomes very stressful. They already are going to probably get schizophrenia, but it's just the stress of being in a new environment can often kind of exacerbate it. And then they wind up having to stop college and come home. I've had a couple of friends that that's happened to, including my uncle, who, she said other people have people in their family. This happened to my own uncle.
Gosh, it really is so much more common than one might think and important to know. Thank you so much, Dr. Dean Sutherland, for explaining this to us. And if we want more information, how do we get a hold of you?
Well, we have a new phone number. It's 941-917-8900. I'm with First Physicians Group, First Physicians Neurology. We just started this group up with Sarasota Memorial Hospital. So Dr. Gregory Haynes is my partner, and he does things that we call peripheral neuropathy and other nerve problems and muscle disorders. And I specialize mainly in movement disorders, which includes Parkinson's disease and tremors.
Terrific. All right. Well, good to talk to you as always. Thank you so much, Dr. Dean Sutherland, and we'll talk to you again next week.
Thanks, Heidi.
All right. And thank you, everybody, for tuning in, and we will talk to you again tomorrow. Thank you so much for tuning in. My name is Heidi Godman. My producer is Luke Roseborough, and you've been listening to Health Check with Heidi Godman on WSRQ. Hope you have a great day, and we'll talk to you tomorrow. Bye-bye.